Vijay Bhaskar. Please come onto the dais, please. So, ladies and gentlemen, today we have gathered here for the inauguration ceremony of our conference. Preserve. The concept of this conference has been preserving the joint rather than replacing the joint. We all know that replacement is the final solution when it gets damaged. But our conference has been focusing on preserving your native joint and how best to make sure that you have a normal joint and it doesn't get damaged. If it does get damaged, then how can we help to make sure that you have a native joint again? So restoring your normal anatomy is what we have been focusing on this whole conference, and it is still going on. So we have planned 9 live surgeries, and so far we have already done 7 and 2 more are remaining, and it is really, really beneficial. Now at the onset, I just want to let you know that what we have been doing. This is the 10th conference that we have been doing every year, and we will continue to do it, and we alternate between upper limb and lower limb every year, and it has been quite satisfying for me to see how things have developed over the last few years. When I started the first conference, there were hardly anybody who was doing arthroscopy in the city, very few who were doing knee arthroscopy, and even few who were doing shoulder arthroscopy. We are talking about 10 years ago. At that stage, we started this live surgery concept, and it has picked up so massively that presently there are at least more than 100 arthroscopy surgeons in the city who are doing extremely good work. Along with this, I also conduct a fellowship program for 6 months each, and so far we have produced 18 fellows who have again gone across to different parts of the country, practicing in Delhi, somebody practicing in Guwahati who has come here, somebody practicing in Chennai who's here, people from Vizag, Vijayawada. All the fellows here have gathered, and they're all doing extremely good work everywhere. So imparting this teaching, imparting this knowledge is something that I gain immense pleasure from, and I'm sure my fellows are also benefiting from that. Because of all these things now, I can proudly say Telangana as a medical tourism is graduated into almost a hub of medical tourism. So a lot of people from abroad are traveling, and it's because of these conferences in every specialty that are helping us develop this. I should give maximum credit to our Managing Director, G.S. Rao Garu, who has always encouraged us to do these conferences, because that is the only way to impart knowledge to everyone. All these things, what I have mentioned, is extremely small. I am only talking about teaching within the city. There is no bigger example who is teaching people and who has become a world-known figure as a coach, Gopichand Garu. Hats off to you for what we have done so far. Difficult job as a coach. It's much harder to teach and looking after their, not just coaching, their whole. So I would like to invite our Managing Director to say a few words, please. G.S. Rao Garu.